Wheeling Plan Commission meeting for Thursday, March 19th, 2015 is called to order. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Mr. Secretary, would you please take the roll?
Commissioner Dorband is absent with prior notice. I am Commissioner Johnson. I am here. Commissioner Powers.
Here.
Commissioner Stylen.
Here.
Commissioner Zangara.
Here.
And Chairman Rafato.
Here. Mr. Jennings, any changes to the agenda?
We have some changes to the agenda. They are all items for other business. We will list them once we get there.
Okay, great, thank you. Consent, citizen concerns and comments. At this time, we allow citizens to discuss anything other than what are items for review or consent items on our agenda. Is there anyone here to discuss those? No. Consent items, docket number SCBA 1510, PostNet 735 North Milwaukee Avenue. Appearance approval of a wall sign. Do I hear a recommendation?
So moved, Mr. Chairman.
Second.
We have a motion by Commissioner Powers, second by Commissioner Johnson. Mr. Secretary.
Commissioner Powers.
Yes.
Commissioner Johnson is yes. Commissioner Stylen.
Yes.
Commissioner Zangara.
Yes.
And Chairman Rafato.
Yes. Items for review, docket number 2015 3A and B, Creekside Health Center, 300 McHenry Road. 215 3A, variation from Title 19 zoning related to required parking. 2015 3B, special use site plan approval for a health clinic. Mr. Secretary.
Docket number 2015-3A and B. Jason Carey, CFO of Greater Elgin Family Care Center, lessee, is seeking the following for the property at 300 McHenry Road, which is within the Creekside Plaza Shopping Center and is zoned B2 Neighborhood Commercial District in order to establish a health clinic. 2015 3A is a variation from Title 19 zoning of the Wheeling Municipal Code, Chapter 1911, General Development Standards, Section 1911.010, Off-Street Parking and Loading, Section E, Parking Standards, Subsection 1, Minimum Required Parking per Land Use Category, and associated sections to reduce the required parking for a health clinic. And 2015-3B is a special use site plan approval as required under Title 19 zoning of the Wheeling Municipal Code, Chapter 19-06, Commercial Districts, Chapter 19-10, Use Regulations, Chapter 19-12, Site Plan Approval Requirements, and associated sections in order to establish a health clinic in the B2 Neighborhood Commercial District. The standards for a variation. A zoning variation is intended to be a method of adjustment to equalize regulations where Title 19 of the Village of Wheeling zoning has created an unnecessary hardship. A variation is designed to allow affected property owners the same rights and privileges that others enjoy in the same zoning district. In order to be granted a variation, a petitioner is required to demonstrate through testimony to the Plan Commission at the public hearing why their request meets the conditions of the village code, including, but not limited to, how their individual situation is unique or unusual. Prior to the public hearing, the petitioner provides written statements meant to show that their request for variation meets the standards established in Title 19. Commission chairperson will typically direct that these statements be entered into the record without a full reading of them at the hearing. Based upon the testimony and supporting materials submitted, the Plan Commission will make findings in support of or against the petitioner's testimony and report those findings to the village board. The standards for a special use. A zoning special use as defined in Title 19 of the Village of Wheeling zoning is a use of a parcel of land that requires review and consideration before approval due to circumstances or effects on the surrounding properties that may adversely affect them. In order to be considered for a special use, the petitioner is required to demonstrate through testimony to the Plan Commission at the public hearing why their request meets the condition of the village code, including but not limited to how the, how the proposed use will not damage the enjoyment or use of the surrounding properties. Prior to the public hearing, the petitioner provides written statements meant to show that their request for special use meets the standards established in Title 19. Commission chairperson will typically direct that these statements be entered into the record without a full reading of them at the hearing. Based upon the testimony and supporting materials submitted, the Plan Commission will make findings in support of or against the petitioner's testimony and report those findings to the village board. Mr. Chairman.
Thank you. In that time, 2 more teams were upset in the NCAA. Mr. Jennings?
There are a couple of staff comments in the report. What I'd like to do is actually have the petitioner come present, and
Great.
if those items are not addressed during the course of the discussion, I'll just make sure we come back to them at the end.
Great, thank you. If the petitioners would come forward, please. Sure, yes. Are you going to be, sir, are you going to be the only one speaking tonight?
Myself and Lupe Fonseca is our Chief Operating
If you
Officer
could
as well.
please come up here, and I'll do this at once. Sir, you're not going to be speaking?
I may.
Okay. Sure, then, if you could please raise your right hand. Do you swear the testimony you give tonight to be the truth?
Yes.
Great, thank you. And if you could give your name and business address to our secretary, that'd be great.
Sure. My name is Jason Carey, and our business mailing address is 370 Summit Street, Elgin, Illinois, 60120.
Lupe Fonseca, F-O-N-S-E-C-A, 370 Summit Street.
The floor is yours, sir.
Good evening. Thank you for allowing us the opportunity to present our proposed project to you all for your consideration. Greater Elgin Family Care Center, as you have in your in the documents that were submitted, is a nonprofit federally qualified health center with its primary operations based in Elgin, Illinois. We've been a Section 330 grantee since 2002 and are currently accredited by the Joint Commission since 2007. That is a voluntary accreditation, not a mandatory one. Our mission is to provide quality, affordable health care for all, including those without the ability to pay. That is our primary service area, is for patients who lack insurance or patients who are publicly insured either through Medicare or Medicaid. We are proposing to provide comprehensive primary care services at our Creekside Health Center. Currently, we operate 7 other full-time health centers currently, and another 24 health centers part-time throughout the year, most of which are school-based health centers. In fact, the school district within Wheeling and the High School of Wheeling, which Lupe can talk about more extensively than I, has been partnering with us last year, and we're looking to partner again this year to provide school-based healthcare services through the back-to-school physical season, again, for those students needing physicals and vaccinations to move forward with their education. Within 2014, Greater Elgin Family Care Center provided care to 37,590 unique unduplicated patients through 125,876 medical visits and dental visits. The project that we're proposing here would be to renovate the outlot building within the Creekside Health Center Plaza at 300 McHenry Road. It would be the community health center housed to serve the residents within the Wheeling, village of Wheeling and the surrounding communities. The building, as it stands currently, is vacant. We are looking to put about $1.3 million total in renovation costs into that building to turn it into a medical clinic, a health center. The health center would comprise 2 floors. The final plans are yet to be completed. What you have before you is our proposed site plan as it exists now. Of course, we'll take into consideration all code requirements once we make an official selection of an architect and move forward with the project. But ideally, we're looking to have 8 examination rooms, a procedure room, sufficient space for our providers to chart and research patient accounts. We're looking to have an internal laboratory area where we can perform wave testings, draw immunizations, store immunizations. We're also looking to obviously house appropriate areas for medical supply storage, office supply storage. We're looking to house several administrative offices that would be needed to support the operations of the Creekside Health Center. And in the lower level specifically, we're looking to add a room that would be operated by Quest Diagnostics. We've received a letter of support from Quest Diagnostics and have the approval of Mr. Young to sublease a portion of the building to Quest to perform phlebotomy services for our patients only. So Quest won't be providing community-wide phlebotomy services out of that location. It would just be for our patients. So if a patient presents at the health center, sees our provider, it's determined that they need labs done. If they can have the labs done then and there, then they'll proceed to have them drawn and be on their way. If it's determined that they need to fast, then they're able to come back first thing in the morning and not have to deal with what they may experience at normal draw sites, and that is wait times, appointment necessary in order to get to work on time. Also, in the lower level of the health center, we're proposing to add an employee break area as well as a meeting and training area. As per our policy and per all of the regulations that we're bound by being a federally qualified health center, we will competitively bid all aspects of the project. This will be our 5th capital project in the last 4 years that we will undertake. If approved, the health center will be open 64 hours each week, operating from 8 a.m. to 7:30 Monday through Thursday, and 8 to 5 Friday and Saturday. Again, we'll provide primary care services in the specialties of family practice, pediatrics, and OBGYN, and it's our intention to expand in the future to include behavioral health services. In addition, we've secured several letters of support from all of the community providers. In fact, we have 28 different letters of support that we submitted in our application to the federal government to operate this location. So we'll be having active referral relationships back and forth to those community providers that exist today. Dental services, substance abuse services, other behavioral health counseling services that we don't offer. Staffing at Creekside Health Center will initially consist of 3 primary care providers. They'll have a support staff of 4 medical assistants. We'll have 2 case managers. It's yet to be determined if they'll be housed on site or if they will be housed in our administrative offices in Elgin. We are waiting to see about some administrative funding opportunities we have within Elgin to make that decision. We will have 1 person on site dedicated to enroll patients eligible into insurance through the Affordable Care Act. We were a grantee through the state of Illinois' grantee program to enroll persons into insurances available to them through the Affordable Care Act. The site will also house a charge nurse and a clinic coordinator, as well as 4 receptionists to begin. We came to choose Creekside Health Center way back in January of last year. We heard from the district, school district in Wheeling. We've heard from the Economic Development Division. We knew the health disparities that are here. The village of Wheeling is actually in a medically underserved population. And we knew that the federal government was going to be expanding their reach in terms of funding that they want for access to primary care services. We solicited the services of Mr. Mike Kurgan of Real Estate Finders. We canvassed all of the available property that met our square footage needs within the village of Wheeling and in the surrounding communities. And and it turned out to be that Creekside Health Center met our needs in terms of size of square footage and the available parking within the complex. So that's how we came to choose that. Within your packet, you've got our application for special use. We don't anticipate that it will be a hindrance to the tenants that are there. In fact, we think that it'll be a benefit to the tenants that are there based on our previous experience with our other health centers. Again, our other 7 health centers, 6 of them are leased. 1 of them is owned by us. All 6 of them are in shared areas. 1 of them is in a retail strip mall type environment similar to this. That health center occupies about 4.8% of that complex, and it has actually spurred economic activity for the surrounding tenants that are there. We think that this will do the same. As we anticipate that within the first year of operating Creekside Health Center, we will have 2,450 unduplicated patients through 4,786 visits. So we're going to have over 4,700 people visit that shopping complex. At the end of year 2, we're anticipating 7,596 unique patients through 15,315 visits. We think that Creekside Health Center will provide the benefit to overcome, in my opinion, the barrier proposed to that shopping complex by that building basically blocking the frontage of that shopping complex. We're going to be able to get foot traffic into that complex, so I think it'll have a benefit there. We do not plan on making any changes to the exterior of the building unless it's required of us. We don't plan on making any modifications to it. It seems like it's in relatively good shape. You might need a little bit of maintenance to it, but no structural changes to the exterior. Therefore, we don't think it'll have any impact on the environment or anything else. We don't think it will damper the adjacent properties. In fact, again, I think it will benefit the adjacent properties. They're all residential properties that surround Creekside Health Center. All of them received letters of notification that this was happening. We think that that's probably going to be our patient base. So I think, again, that it will have a benefit to the community residents that immediately surround Creekside Health Center. We feel that parking is adequate within the shopping complex based on what's available currently. Our understanding is that the parking variance was required due to what the demands are of our project, coupled with the parking demands of the current tenants that are there. But in looking at the parking spaces that immediately surround that building, most of them are not in use, and no matter when the time of day is, whether it be in the morning or in the evening. So that's is our project. So I'll be happy to answer any questions that the commission has.
Thank you. This is a public hearing. Is there anyone in the audience that wishes to speak on this matter? No, thank you. We'll now go to the commission members. Commissioner Powers.
Thank you, Mr. Chairman. Andrew, I have a question for you. Just to test my understanding, there are 185 stalls in the shopping center, correct? I mean, that's what I heard was in the packet.
Yes.
Okay. And the furniture store, which was there before, was allocated 17 spaces, and we're asking for a variation to go from 38 to 21. Is the reason we're going to 21 because those are the only allocated spaces left available out of that 185, considering the occupancy of the shopping center at the current time?
Yes, the shopping center, calculating the parking for the shopping center, including the previous use, which is now vacant in the subject building, that building balanced out with the shopping center in terms of the code between that building and the other variations that other units, individual units had already received. So yes, it was that building using a standard standard requirement for the previous use sort of hit the even point as far as the code is concerned.
Okay, so is that to say that if there were any vacancies in the shopping center now, if this were to get approved, that there would be no spots for those vacant tenants to actually park using the calculation?
Each unit, when a unit is vacant, we tend to hold that in the total table calculation for each shopping center. What we do when there's a vacant unit, we keep allocating it at what its current use is. So if it leaves and it has a valid existing special use, for example, until that special use expires, we hold the allocation just to keep the table intact.
So what you're saying is that I know there's vacant units, we're holding on to some spaces for those, correct?
If they are counted at 4 per thousand, they still have a parking requirement at 4 per thousand, for example.
Okay. Okay, so I have a couple of questions about answers that were given in the standards for variation. One of them says, we don't believe there's another entity operating as a special use B2 zone medical center in the village of Wheeling. The question I have is, what is the zoning for Lynn Plaza? Because I know Concentra is in there. Is the Concentra in Lynn Plaza, is that a similar type use to what you're going to be offering?
My understanding with Concentra is that they do more occupational health type services
Okay.
and not true primary care medical home type services, which is what we would be offering.
Okay.
So I think that there is a difference between the two entities.
That's good. Question number 4, it says, could you tell me, what do you perceive as, you mentioned something, a defined service area. What is your definition of a defined service area?
Sure. So that comes out of our federal grant application. So in order to operate a federally qualified health center, we have to apply to the federal government and identify a service area. So that way the federal government can analyze whether or not the service area needs are met or not met. And so the defined service area is what we have, that's in the application, is what we have defined as part of that application. And that would, to be honest with you, is the town's village of Wheeling and then Prospect Heights.
Okay,
Is the
that's
center.
good. Then the statistics, you mentioned like, you said 27.6 of 54,000 residents. So is that the combined population of
Correct.
both Prospect Heights and Wheeling?
Correct.
Okay.
Yeah, based on the data source, that is the population.
And what is the federal poverty level? How is that defined?
200% of federal poverty. So each year, we receive updated federal poverty levels, and we're required, one of the core requirements of a federally qualified health center is to offer a sliding fee discount to patients that are underneath 200% of federal poverty.
Okay.
So for instance, a single person right now, to be 100% of poverty is 11,000 and some change. So 200% of poverty would be somebody making $22,000 annually. So that's what that reflects. And again, that's our proposed and target service area are those patients that are 200% and below. That doesn't mean that we don't serve patients above 200%. It just happens to be those are patients that are our target because they're the most underserved.
So would you deny service to anybody who didn't necessarily meet that criteria and turn away?
No, our mission is for all.
Okay.
All, including those without the ability to pay. We write off literally tens and hundreds of thousands of dollars a year due to inability to pay.
Okay. You said you received a lot of letters, but you also said Village of Wheeling. Are those from residents of the Village of Wheeling and not the village itself?
So the 28 letters of support that we received, some of them are from political entities, state and federal government representatives and senators. We received a letter from the Village of Wheeling, was one who supported this. The Prospect Heights supported us. We also received letters of support from all of the social service agencies and hospitals. So Northwest Community supports it. I know that we received one from Advocate for Lutheran General. So it's all the above. And we requested letters of support from the existing primary care providers who we identified currently serve the Medicaid population, but we weren't able to secure any from them.
Okay. Will you be hiring new employees with priority given to Wheeling residents at all?
Yes, we do that.
Okay.
For a variety of reasons. They know the area, they're familiar, so yes, yes, we will do that.
Okay. Let's see. One question for, is the owner of the shopping center here? I have one question for you. Have you ever received any parking complaints about the west side of the shopping center at all since you've owned it? About problem
If you
like
could talk
not enough parking and stuff like that? Has that ever been expressed to you as a concern in any way?
I've never heard of any complaints at all of any parking shortages.
Okay,
Nothing.
okay.
Seriously, nothing.
I think that's all I'm going to ask for now. Thank you, Mr. Chairman.
Thank you. Commissioner Stylen.
Thank you, Mr. Chairman. I got a little kink in my back, so.
Okay.
I think the proposed use is excellent. You know, you're virtually on two major highways that will help a lot of traffic, be very easy for people to get to. I think the use is needed, and I believe you would be very successful. I guess my concern is, and always has been, the parking situation. Steve said that, you know, something about the number 23, that the variation was for 23 parking. And I believe that the way I read the staff report is that the variation is to have an approved 17 parking spots. Is that, what is the number in?
So the number that's allocated to the building right now, the building itself was held in the parking table at 17 spaces. That was based on the amount of retail space in the building previously. This variation, based on the employee count of, I think we had a maximum in the table, I think we were using a maximum of 20 at a time, and then the number of exam rooms came out to 38. And so the reduction would be the difference between those two things, the calculation by the standard code of 38 versus what's allocated to the building at 17.
Okay, so we're looking for a reduction of 23, bringing the allocated parking down to what it is basically today, 17.
Yeah, the 23 number came from a
Calculation,
the
standard.
the 21 is from the calculation. The 23 is only, it was just a note in the staff report about
Handicap
potential for
parking.
additional handicap parking. So if two stalls are converted to handicap parking, there would be, the variation could go up. So I was just trying to throw out the possibility that if the commission and the petitioner agree that additional handicap parking is wise, given the nature of the business, that the variation number could increase slightly due to that.
Yeah. You know, I just have, I believe that when we create a variation, it should be for the number of parking spaces that are going to be actually used, anticipated to be used, whatever. And you have 40 waiting seats currently on your floor plan, 20 staff, 9 exam rooms, whatever, 3 behavioral health rooms. That's, my guess is you've got potentially 60, 70 people spots in the building. And if you say, well, 50% of them are occupied, which I think is probably pretty good, you'd get down to the 38 number that our village code requires. So I really think that, maybe not the first year, the second year, I hope you're very successful. I think you're going to need those 38 parking spots. And if we give you a variation for 17, that means you're going to be using, I believe, in the long term, potentially 23 parking spots that could belong to somebody else. Now, that somebody else isn't going to be able to do the business that they would like to do. Or conversely, if they're more popular than you are, then your business will suffer because they were successful. You know what I mean? So we recently redid all the parking calculations. We recently came with a reduction factor to allocate to large parking areas. I don't know, Andrew, is this property large enough to apply to that?
No, that scale has been pushed back to where this shopping center is not large enough for that.
Okay. So we have adjusted things, not necessarily for this property, to try to make the parking requirements as close as possible to what we thought would be required. So I cannot in any way approve a 55% reduction in the parking for that variation. Now, if there was something that, we could fine tune or tweak the other uses of the property, take some tables and chairs out of the existing restaurants, something like that, because that's how all our calculations are basically based on seating and stuff, then I'd be willing to adjust the numbers. But right now, I just can't see doing something that, today it appears that the shopping center is empty, but the shopping center isn't, I don't want to say overly successful, but it's not meeting its peak uses. So, and I don't want to do something to impede that. So, I think your use is perfect. I'd like to see you in our community. I think the spot that you've chosen is great, and there are some other areas in town that would be just as good. I'd love to have you here, but that parking is my pet peeve. So that's.
Can I address one item, and that is the number of seats within the health center? It does appear on the floor plan that it would be where we could house 60, 70 cars in there at a time, or people at a time. Now, the reason why it is that way is we see a lot of families, and so families will travel obviously in one automobile. And some of our patients actually won't even travel by automobile. They'll travel by taxi. We have a taxi program. Some of our patients don't have cars. Some of them will walk. Some of them will walk from the bus stop. So although it appears that we have a lot of seats in the waiting area, it really is only going to house what is needed by the 3 simultaneous providers. And just a couple of your comment, our McHenry Community Health Center is almost identical in terms of square footage. That health center is 8,600 square feet, so it's a little bit bigger than the total square footage that we're talking about for Creekside Health Center. That parking lot has 50 spaces and 14 examination rooms, and we have never maxed it. And it's been open since 2011.
And do they do the same kind
services.
of services,
Yes.
Income levels,
Yes.
and people taking buses or public transportation, et cetera?
Yeah.
See, and that's partially my problem as well, because once we give a variation, the variation stays on that building forever. So you could sell the building to a regular medical clinic that had a completely different client draw. And because they had the variation for 17, they'd be allowed to come in and start use, even though, I mean, their use would be the same as yours, but they'd be potentially drawing from a different clientele base that might not walk, might not take buses, et cetera. And those are some of the things I think we have to be cognizant of. But I don't want to take any more time. I'll let the other commissioners have a chance. Thank you, Mr. Chairman.
Commissioner Johnson.
Thank you. Are the physicians that are going to be working here, are they like permanently assigned?
Yes, they will be permanently assigned.
They're not rotating?
No,
health plans?
geographically, it doesn't make sense to rotate
Good,
them over
okay.
to Elgin.
All right. I don't think you're going to have a problem with parking. I go through that lot all the time, and it's, you know, other than late at night when the little nightclub is busy, there's always been plenty of parking. Unless it's a big pizza night down at Wapagetti's, and it gets a little crazy around there, but I think it's a great use for the building. Really have nothing else at this point. Thanks.
Thank you. Commissioner Zangara.
Thank you. Thank you. My question just regarding the parking is, when you were going through your numbers, I calculated 16 employees as you were counting. Where would they actually park? Like, do you have a place where they would?
Yeah, the employees would park along the perimeter along McHenry Road to, I believe that's the east side of the building is where we would have our employees park. That's our policy at all of our health centers is obviously our employees park as far away as possible. Now we'll take into consideration other tenants. We're not going to go have them park in other tenant space, but we'll utilize basically the big abandoned parking spots up there that aren't utilized is where our employees would park.
Okay. And I kind of agreed. I understand the 40 seats, but I go to the doctor, I bring 2 kids.
You got
so
kids, and strollers, and all kinds of stuff.
I understand that. My other thing, going to the floor plan, I know you mentioned not doing anything to the building. That door and that reception area is really close.
Yeah.
You open that door, your receptionist's going to be wearing a winter coat in the wintertime. My thought, just a thought here is, I don't know if you've been down to our Bob Chin's down here. In the wintertime, they have a temporary, and it'd be a suggestion because you're going to have a wind tunnel coming through that thing. And
Sure. If I can address that, when we did the floor plan, the proposed floor plan, it was a 4-second meeting in the space with Mr. Young, and we were not sure that we could move that stairwell. And we believe we can move that stairwell, which will then give us the opportunity to maybe reconfigure that space. We have the similar setup to this at our Streamwood Community Health Center. Okay. We've actually installed heat lamps above the reception desk to alleviate some of those conditions, because yes, it will get cold. And wherever we can fit a vestibule in, we will try to stop that from happening. So.
okay, besides that, those were my basic issues. I didn't know the checkout, so when the way this planned, I know you said it's a quick plan, I'm surmising they go in on the left-hand side and they come out the right, but then they go right back out the front door? Would it be, I saw the building, there would be no chance to do an exit out that side, so they're not going right back through the vestibule again?
So the question that's on the table that we're evaluating came up obviously through the fire department's review of our plan, and something that we thought we probably would need to do, but weren't 100% positive. That's locate a second exit from the lower level. So that may alter what our options are in terms of an exit, besides going all the way through the front and out that door. If there's a way to bring it out more in a different place, then we will do our best to try and locate that in the most ideal situation.
Perfect. Well, I hope it works out. That's all I had.
Thank you. A couple of things. You were talking about potential, I think you're starting out with 19 employees, and then with a potential to go up to 28. Is that what I read? Would you have 28 all at the same time?
No. We would be around 20 at the most simultaneously.
20 at the most simultaneously?
Yeah.
Okay.
And that's due to our extended hours? So we are planning to be open from 8 to 7:30, Monday through Thursday. And of course, most of our employees work 8-hour shifts. And so there's usually 2 shifts of employees and they switch out. So we, at our other health centers, we're never at full capacity with employees.
Okay. Do you have peak hours? Are there times when it's busier than other times? I would assume that probably 7:30 might not be as busy or whatever.
That's
If you
actually-
could talk into the microphone, that'd be
Sure.
great.
So historically, in our Elgin locations, actually all of our health centers, Monday morning is our busiest day. So by 7:30 in the morning, there's usually, all of our patients have arrived, and it is when we're most fully staffed. By about 6 o'clock in the afternoon at the latest, usually around 5, it starts to definitely die down and there's much less traffic. That's due to the fact that we don't have many providers that want to work very late nights. So most of them come in early, but are leaving by 5 o'clock, 4:30 or so. And so there's typically only 1, maybe 2 providers running until 7:30. There's definitely less patients coming through the door at that
So it's
point.
pretty constant from 7:30 in the morning until 4 in the afternoon?
No, there's definitely a lull in between the days. So it seems that our appointments are the morning appointments are very sought after, and so are the early afternoon. But in between, the middle of the day, it certainly tends to become a lower volume.
Thank you for those answers.
Sure.
What about, is there any need for lighting in that? I wasn't sure if I saw lighting. I may have, but I missed it.
In the building itself,
Outside?
there's existing soffit lights and there's existing parking lot lights for the shopping center.
Okay, we got to make sure they're all working then, because I've gone through there and it's been sometimes dark, so we've got to make sure that those are working. Also, are the awnings that are there, they're staying, the blue awnings?
Yes, everything exterior is the responsibility of Mr. Young.
Okay.
So unless he decides to change it in conjunction with the rest of the complex, as the building looks exteriorly is how it'll look. Obviously, at some point, we'll be present again for a sign request, but.
Just going to ask that, right?
Yes, but as it stands, other than that, it will look the same.
Okay. Now, this, Mr. Young, these probably are for you. One, we heard that, I think Commissioner Powers asked about, didn't you ask about hiring local folks? And actually, the target audience is local. Are there rooms to put bike racks there? In, somewhere in,
Well, in this location, you can correct me if I'm wrong, but in this location, you do have the overhang. It would be possible, this appears to be wider than a 5-foot sidewalk. You'd probably have room at this location to do outdoor bike racks. As far as the indoor bike racks, we could certainly work with them on where that could possibly go.
I'd probably prefer an outdoor, because, indoor, they've got a lot of stuff going on. So,
It looks like you could probably.
well, if we could get a condition, I think the
Yeah,
board would
good
like
idea.
that as a bike racks. Also, Mr. Young, this is a perfect picture, that tree right there. I'm sure that's not snow.
I've noticed that, so have my landscapers.
So you need to upgrade the landscaping. It's in terrible shape. And also, the parking lot's in terrible shape also. I think along the east side, where the employees are going to park, I would like to have somebody look at that and see if it's required, either, just scraping it and resurfacing it and restriping it. But
It's restriped every year.
it is restriped every year.
Yes, it is.
Whew, boy.
Yeah, very definitely.
I don't know when this picture was taken right here.
It's winter.
Oh, yeah.
You got salt.
Well, no, actually, well, let's see. I'm looking at Google Maps, and I have to tell you that the parking stalls in front of, now I'm not sure how old this is, in front of, right across from this proposed site where the restaurants are and the dance studio, those look like they haven't been striped in a while. And if you're striping every year,
It was restriped in summer of this year, right after some pavement work was done, yes.
okay, even what's, I don't know,
It
what,
probably is a very old picture.
where is that taken from, Andrew? Is that-
This is out of our GIS. I'm not sure of the date of this one.
Okay, all right.
That's an old picture, sir. Because you can't even see any of the new pavement work that was done this year.
Okay, you have done pavement work. So this is restriped every year?
Oh, yes, sir.
Okay, all right. Pecos bike rack, so a bike rack. I too don't, thank you, sir. I too don't have any, I think the parking is sufficient, and it's a tough, that's been vacant for many years. So it's been probably tough to lease that, and I think this is an appropriate use. I think everybody agrees upon that. It's just a question about the parking, and I think that will take care of itself. In a typical day, and I know not every patient is typical, but I'm sure you have some metrics as to how long a patient stays in.
Yes, we do. So we do cycle time studies at our health centers, and what we have found is that on average, it's about 45 minutes from when the patient walks in and signs in. They typically walk in a little bit ahead of their scheduled appointment, and through the end, and that's, considering anybody who has to have blood work drawn with our lab core on site. So it does account for everything that the patient does.
Okay. Thank you. 45 minutes. Let's see. I have nothing else, Mr. Jennings?
Commissioner Steinman.
Oh, okay, Commissioner Steinman.
Just a question about the patients, not including the lab work. Are all the patients have designated appointments, or can they just walk in and wait to be served?
We do have some patients that choose to walk in and be served. However, we've been educating our patients that we have both same-day appointments available, so that if you call, you can get an appointment the same day. We also have next-day appointments available. If you're feeling sick in the afternoon and want to schedule something for the following day, you can also do that. And so the majority of our appointments, I would estimate at about 90% of our appointments are definitely appointed and not walk-ins. We have very few.
Thank you.
Mr. Jennings?
Just a couple of things. Before I get into the notes from the staff report, there's a suggestion regarding the a vestibule. If that vestibule were to be under the overhang, would the commission prefer to see that back as an appearance review, or is a vestibule such as that acceptable as a solution if they do decide to go outside under the overhang?
As a temporary winter structure,
Yes.
I think as a temporary winter structure would be okay. My problem is most of the winter structures that we've approved seem to become permanent after.
24/7, 12 months a year, right?
Yeah.
Yes.
Yeah, I'd prefer to see it inside. It's probably easier for you
Right.
in the long run to do that.
Yeah, that would be my preference, too.
So I will leave that
Commissioner
out of
Sinclair?
conditions of approval then.
One question I have is, I know you mentioned once that you put this plan together real quickly. If this gets approved, is this the plan that will go?
Actually, I was just going to bring that up. I remember that, yeah.
We've had this discussion with the petitioner and the fire department, actually, of exactly how to approach it, given the constraints of the petitioner's funding process and the approval process for their particular business. The parking requirement that we have is based on based on the number of exam rooms and the number of employees on a peak shift. We spoke with the petitioner about this, and they were in agreement to commit to the maximum, as illustrated here, the maximum number of employees, the maximum number of exam rooms. As they've stated, there's some fluctuation expected in how they break up the space. One solution might be organizing the lower level on a corridor instead of the way it's currently shown with the U-shaped hallway. Another solution that has come up tonight would be to relocate the stairway so that you do have two remote stairways to the first floor from the lower level. So the staff is okay with that. We just wanted to make sure that the commission understood that that if this is recommended onto the board, that would be the expectation, that the maximum exam rooms and employees that are represented would be the limit if this were to proceed to permit review.
Okay, I'm comfortable with that. Commissioner Powers?
Thank you, Mr. Chairman. One thing I did notice when I went by there today is the fence on the side of the west side of the building where the trash enclosure is going to be, it's kind of collapsing. Will that be, can you repair that? Get that straightened out? I guess I'm asking, the owner of the shopping center.
It did take a beating during the winter, yes, I'm aware of that. Oh, it did take a beating.
So will you fix that for us?
I have a couple of my other shopping centers also had the same problem, and I've contracted with a fence company in order to do repairs onto it.
Okay, thank
So
you.
we'll put that in as a condition.
Yes. The other thing in the staff notes was the mentioning about possibly power washing the building.
Yes, there was, during the review of the monument sign, I would say probably 2 years ago now, the commission had requested that it be power washed to
Yes.
get it back to match. The north side of this building could probably use sort of the same treatment.
We put that in as a
That was
condition.
the
Yep. You okay with that, sir?
Sure.
Okay.
One last thing. How many handicap spots are currently around that building right now in the area of like in front of the building? I saw one today. Are there more? Is there more than one?
It looks like there's a second one across here, and then one next to the building.
Okay. So if there's more, if there's at least two, I guess I'm okay with it. I just want to make sure there would be more than one.
There's one next to the building, as was pointed out,
Okay.
and there's definitely right in front of the building also.
Okay. All right. I have nothing further.
Does anyone else have anything?
No.
Nothing? Okay. So we have, Andrew, do you have anything? I'm sorry.
I think that covers everything that we had. I just want to read off the conditions of approval.
Okay. On the special use?
Yes. Just finish typing one of these real quick. There were no conditions attached to the variation. The conditions from this discussion that would be recommended to the board with the special use docket are that the petitioner provide outdoor bicycle parking. Number two, that the floor plan may be revised, provided the maximum number of exam rooms and employees remains constant. Number three, that the trash enclosure is repaired. Number four, and that the exterior of the building is power washed.
Great, thank you. So we'll take the docket separately. Is there a motion on docket number 2015-3A?
So moved.
Second.
We have a motion by Commissioner Zangara, second by Commissioner Powers. Mr. Secretary?
Commissioner Zangara.
Yes.
Commissioner Powers.
Yes.
Commissioner Johnson, I vote yes. Commissioner Steilen.
No.
And Chairman Rufato.
Yes.
4 yes, 1 no, 1 absent, and 1 vacancy.
Mr. Chairman, I'll make a motion on 2015-3B, special use approval for health clinic.
So, second?
We have a motion by Commissioner Powers, second by Commissioner Steilen. Commissioner Powers, Commissioner Powers.
Commissioner Powers?
Yes.
Commissioner Stylin?
Yes.
Commissioner Johnson is yes. Commissioner Zangara?
Yes.
And Chairman Rafano.
Yes. Back to 2015 3A, variation from Title 19 zoning. We normally ask the petitioners that voted no to state the reasons why to the variations. Commissioner Stylin?
Variation standard 2 is that parking standards apply to all shopping centers, and this center is no different than any other shopping center that we have in town that similar rules apply to. And variation standard number 3, under giving more parking away that they are definitely going to use than we're giving a variation for could cause the intensity of use to grow and be detrimental to other users in the center.
Great. Thank you. Do I hear a motion to close?
So moved, Mr. Chairman.
Second?
All those in favor?
Aye.
Good luck.
Thank you.
Thank you.
You'll have something to sign. And
While you're
reading?
signing that, there, just one procedural note while you sign, what we have for you is just a printout of the conditions that have been recommended. The Plan Commission recommendation at this point is forwarded to the village board. The village board, the elected officials make the final decision on a special use and a variation. I would project that at this point to be the first April meeting, which is April 6th. You can check back with us about the scheduling of that agenda item, but you can pencil it in for April 6th and be in touch with our staff.
What would be a good time to circle back around on the date?
If you would like to call us, we'll be back in the office tomorrow. Usually we set those, the actual meeting dates during the staff meetings, which are on Mondays.
Okay, can you see Google? Do you have Google Maps?
No, this one's,
What?
he restripes, but he doesn't see it.
So Denoyer Trail goes right through on Google Maps. Denoyer Trail goes through. Google Maps says
When do you
Denoyer
think
Trail goes
you
right
might be in a position to, when do you think you might be opening?
Hopefully.
Yeah.
Are you, does Illinois funding affect you at all?
No, well, sort of, it could. Our reimbursement under Medicaid is tied into federal statute. So unless they change federal statute, then that wouldn't affect us.
You're lucky, I think.
This is going to be funded through Grant Funds Direct. We'll find out in May.
Thank you. Good. So these are Andrew. Oh, there's one with each, sorry. Approval of minutes. We have none to approve this time, next time, maybe? Okay, thanks. Other business, Mr. Jennings?
Yeah, I have a couple of items of other business. The first item, Midland Paper, who I think was most recently in front of the commission for a flagpole addition, landscaping at the corner of the building. Midland Paper has a land bank parking covenant with the village. The business is in the process of going through the permit work associated with building out a mezzanine area inside the building. In conjunction with that work, they would be building the land bank parking. Our review thus far is that everything that's being proposed is within the scope of the previous approvals associated with this. They do have some, as you can see here, they are going to continue the row of windows from the first floor. Identical windows will be placed for the mezzanine level. Given the location and the appearance being identical to the other windows, we determined that this is consistent with the appearance of this building already. We did want to give you the heads up, though, in case you saw work proceeding both on the facade of the building or in the parking lot, that you were aware that the permits had been reviewed by the village. So that is one item. Any questions on that one?
No?
The town center project, which is the main portion of that project, is the Wicks property. It also involves reconstruction of the commuter parking lots next to the tracks. The concept review for that plan unit development with the concept review with the board is scheduled for March 23rd. Based on the direction of the board at that meeting, it's possible that the Plan Commission review of the concept could proceed fairly rapidly after that. The developer is on a projected schedule for completing all of the zoning approvals, and we'll be working with them to schedule their meeting with the Plan Commission following the board review. But we wanted to let you know so that you could watch the board meeting if you'd like to. We did have a couple of requests then related to the Plan Commission's priority list. Commissioner Stylen had asked us to get the list back out and go through it and have a discussion with the commission. One thing that we had looked at on this list, and I talked to Chairman Rufato briefly about this, is that since the list was last evaluated, the village has undertaken a strategic plan process. And the suggestion that I made to Chairman Rufato is to distribute the strategic plan to the Plan Commission along with the list so that the commissioners could take a few minutes to look at them side by side and then come back next week to go through both of those documents together, having had some time to go through everything. And that's how I'd like to proceed, if that's okay with the commission. We can talk about that. I think.
Comments?
Go ahead.
Good idea.
Good idea. Good. Yeah.
So we can put that, as of right now, there are no items on the agenda for next week. We can put the strategic plan and the project, the priority topic list, both into your iPad folder. You can sync both of them, take a look at both of them. Related to that, we did have this request regarding the overlay districts. That had been one of the items on the Plan Commission priority list. I went back through the notes to see kind of where we last left it. We can certainly bring that up next week and go through it. I do have, I went through and found the minutes of the meetings where it was discussed, so I have that information. If you'd like to go through it, we can. But the consensus so far from the last two joint board meetings, there was some direction given to specific items, given to the commission regarding specific items to work on that had some overlap with the ideas from the overlay districts. That there was no specific direction, though, to pursue the overlay districts. So I can get all that back out. I can put that in the sync folder as well, so you guys can have all that.
That'd be great.
And we can come back next week. And
Do you
go through
recall when we last discussed it, who was on the Plan Commission? Commissioner Zangard, do you remember any discussions on overlay?
I think
Commissioner Powers?
I don't know.
I remember some.
So I think, well, I didn't think Commissioner Zangaro was on the board at the time, and maybe when we have a discussion next week, we discuss what an overlay district is,
I won't be here.
or
you won't
could
be
be,
here?
or-
Oh, okay.
Well, of course, you'll watch that from wherever you are.
Of course.
Yes, of course, right, exactly, right.
I printed out, I can leave this with you all on the way out today. I did print out, staff, at the last, I think the first time that we printed out or produced a description of an overlay district was for the 2013 joint meeting with the board. At that time, the commission had gone through its priority project list and selected a few topics to bring up to the board. The chairman wrote a memo to the board requesting that those topics be discussed. Staff then supplemented that with some background information for the board. So that is our definitive introduction to overlay districts. I printed enough copies of that I can distribute them on the way out.
Excellent, thank you.
Mr. Chairman?
Yes,
You know, I'd kind of like to recommend that, I mean, even though some of these were my ideas, I'd like to recommend that we not really take any action until we get a full plan commission back in order. That should be April, May-ish timeframe. Putting it off for a couple months shouldn't really hurt
you mean
anything.
even a discussion we were going to have next week?
I would think so, yeah.
Okay, that's fine.
You know, I mean, otherwise we'll just go
No,
through.
you're right, and you're right, and Commissioner Zangaro wouldn't be here next week anyway. and
Right.
It's important that he's here. So, okay, I'm fine with that. I'm sure you guys would be fine with that right now, and maybe we can,
There's probably going to be some basketball games on next week, too.
pardon?
Probably some basketball games next week.
Oh, yeah, okay. So, thank you, Commissioner Stein, that's a great idea, because you're right. It would be helpful, especially if we start comparing the list to our strategic plan.
Right.
Yep, okay, good. Well, thank you, it's a good idea. Well, we at least have a plan moving forward, so to get back on it, and I should have, once we were done with our last big item, we should have just gotten that list out again and attack it, but I didn't, so.
You know, the list, just so the commission is aware of it, a lot of these projects from the last joint meeting and the meeting in 2013, the commission has done many of the things that the board had asked the commission to do. So the commission had suggested a couple of potential projects. The board selected some of those projects, but then added on to it. And the commission has done many of those things, one way or another. Those projects have been, either substantial progress has been made, recommendations have gone back to the board, or in some cases, the project has gone through completion to the point of implementation. So we can kind of discuss some of that and take stock of
Sure.
what has already been done
Yep.
when we get that discussion going again.
Exactly, okay, great, thank you. Anything else?
That's it for me.
Okay, great. Other business, Commissioner Powers.
Yeah, just one thing. I'm still a little bit confused as to parking variation and the counts, and when the counts stay with a special use and like when they would get reset. So if I can just pose the example for what we just heard, the special use, it used to be the furniture store that was allocated to a certain number of spaces for that use, correct?
Yes.
And then now that the use has changed, and now we're going to healthcare, right? So now that parking, that count is gonna go to like 21 if it gets approved, is that right? So that, how does that work? I'm still confused.
So the short answer to that is the way that the parking for a shopping center works is it's the sum of its parts. The individual uses each have their parking requirement. You add up the sum of those parking requirements, and that is the code required parking for that shopping center. Most of our shopping centers are old enough that some of those individual units have received a parking variation. So their allocation has been brought down to a variation level. So in the example of Creekside, there are 3 units in Creekside whose parking allocation is already leveled off somewhere below its the three restaurants, the Wapagetti's has a parking variation, the Jazz Cafe has a parking variation, and El Famous Burrito has a parking variation. So the 180 count, or 185, includes those variations already. The actual code required parking for the sum of the uses at Creekside is probably closer to 210. What's upsetting the balance right now is the proposal of Creekside Health Center. So to balance back out, they as an individual unit need a variation. We did have, back when we revised the residential parking requirement, there was a discussion that we had very briefly that didn't really go anywhere of completely changing the commercial parking requirement to put the burden of the parking variation onto the owner and not so much onto the individual units. We had a couple of different samples of how you could possibly do that. The direction at that time was that we were close enough to everything balancing out that minor changes were suggested. And the idea from the commission at that point was if these minor changes don't address what we view as the problems, then we can come back and talk about a bigger overhaul. But at that point, we made the change to the anchor tenant parking requirement and made a employee-based requirement for anchor tenants over 20,000 square feet. We increased the threshold of the parking reduction, as Commissioner Simon pointed out, under Creekside tonight. Creekside is no longer eligible for a automatic reduction in its parking. So there were a couple of minor changes that were made, and if it's the consensus of the commission, we can always take a look at that again and see if it seems like that's not working.
Okay, that's it. Thank you.
Anything else, Commissioner Powers?
No, Mr. Chairman.
Thank you. Commissioner Johnson?
I've heard that the groundbreaking for the Whitley Autumn Leaves thing is April 1st at 1 o'clock.
Is that
2 o'clock.
Is that a joke or an April Fool's Day?
No?
Okay. Well, cool. Excellent. Commissioner Zangara?
I have nothing.
Commissioner Stylin?
I don't have anything this evening, thank you.
Good, thank you, thank you. And again, I want to reiterate one thing about using we have to get into the habit of using the village email for village business. Andrew's told me that we have gotten a number of Freedom of Information Act requests, and you know, if we are sending things from our personal emails, those could be subpoenaed also? And is that potentially? So let's try to get into the habit of using that instead of our personal emails, so we don't have the poor village folks having to copy everything out of your personal email, and then that becoming public knowledge.
Mr. Chairman?
Yes.
I mean, to me, it's very difficult to type some of the long, lengthy things and do all the cutting and pasting on an iPad. I would ask that we ask the village IT department if it would be possible or even feasible to open up POP or IMAP access to the Exchange server. Exchange supports both those kinds of access, which would allow Windows Mail and many
Isn't it-
other.
You can log on to it.
Isn't it an Exchange server now? I
Yeah.
believe it is, you can log on.
You can log on from the village website if you go all the way down to the bottom.
Really?
There's a link to the village webmail.
Oh, I'll
Oh,
give
that's
that
cool.
a try.
That's good to know.
You have to know your username and password.
Perfect.
No problem.
That's great.
Problem solved. Maybe, yeah. Okay, great. I have,
I don't like typing on the iPad either.
no, it's not that bad. You have something to pass out?
I'm
Parting
gonna look
gifts?
at these real quick and figure out which one was the best, because one of them actually has the
Still hard to
full
paste, though.
description of what an overlay district is. And I think I will pass that one out and skip the other stuff. That is this one.
Well, Caesar's updated, right?
3 this way? One.
I think one of these may, since I have it printed, one of these may have the, one of these may have the summary of what the board said. It's in the minutes. It's not very detailed. There was not much discussion about the overlay districts. There was a little bit about it, but
Oh,
not,
that one, oh, okay.
not much.
Okay.
Um,
Then you can't hold it to it.
I'd like to say, there it is.
Under background information.
Oh, it's this one. Yeah, this guy. There's a brief summary of what the board,
Is that what you guys gave us, or no?
that is a different,
Okay,
this is the next
right.
year. I updated on the previous year.
Commissioner Powers pointed out that this one hasn't been written for 90 years yet.
It's, I noticed that after I printed it. that The original must have been like that too.
Andrew, didn't we talk?
Planning is about the future.
Yeah.
Yeah.
Didn't you give a presentation about like an overlay district in Glenview and stuff like that? And what they were doing, like on Milwaukee Avenue? Wasn't that part of the presentation?
We've had a couple of different discussions. One, yes, that was part of one of the,
That one I was here for.
we did include a couple of examples in that. And I think that was during the industrial lane comp plan update discussion. And their consultant, our consultant looked at that as well. So it's been brought up a couple times, a couple different ways, and we can certainly bring it up again. But I just want to make sure that you had, well,
Yep.
it's been a while, so just kind of wanted to send out what we had last time.
And lastly, I forgot to ask Mallory if she had anything. Or Brooke? Okay, great.
You know, she changed her name while you were
I
gone.
know. And congratulations again.
Without plan commission approval.
Motion to, motion to adjourn.
So moved.
Second.
All those in favor?
Aye.
Opposed? Good meeting. Good questions tonight. Thank you.
Yeah, doesn't Brooke